Welcome back at 7:23, and September is Prostate Cancer Awareness Month. The cancer, one of the most common types among men. According to the American Cancer Society, 1 in 9 men will be diagnosed with the disease in their lifetime, but when found early, it can be cured. Joining us now from Dell Seton Medical Center School at University of Texas in Austin is Dr. Charles Osterberg, Chief of Urology. So I guess could you just start by explaining what is prostate cancer?
Sure, Tom. Thank you so much for having me today. So the prostate is a small gland that sits directly in front of the bladder and directly in front of the rectum. The prostate gland itself is responsible for our male reproductive cycle. Now, as it turns out, as men age, starting at the age of roughly 50 and on through the age of 70, they are at increased risk of developing prostate cancer. So what happens is cells in the prostate continue to grow out of control and ultimately develop into a full-blown cancer. The prostate gland itself is ultimately responsible for production of the male reproductive cycle. However, in the cases of cancer, when those cancer cells continue to grow, that's no longer the case.
Okay, and I think this is something that just as a man you're aware of, you hear about. But when is the right time to actually go to your doctor and have a conversation about screening and that sort of thing?
Sure. Well, that's actually somewhat of a controversial question, but our current guidelines state that roughly around the age of 55, a man should go to his primary doctor and discuss the risks and benefits of screening.
Okay.
And typically we say screening occurs roughly every 1 to 2 years, and screening comes in a twofold manner, and that includes both a digital rectal examination whereby we examine the prostate in conjunction with a blood test called a PSA, which stands for prostate-specific antigen. And those two screening tests comprise what we consider a typical screening for any man over the age of 55. Now, if you have a family history of prostate cancer, typically we recommend screening slightly before that. Again, this is a shared decision-making process with a man and his primary doctor.
So, and if you are diagnosed, just what is the treatment option? What does that process look like?
Sure. Well, it turns out there's actually quite a few treatment options. And when we think of prostate cancer, it comes in several flavors. And I like to think of it as the good, the bad, and the ugly. For good prostate cancer, we can actually just watch it. In fact, we recommend against treatment for that. And typically that looks like every couple of months we do a blood test as well as an examination, and then oftentimes perform a repeat biopsy. In the cases of the bad and the ugly types of prostate cancer, those we recommend some sort of treatment for, and that comes in the form of either surgery or radiation.
Okay. So these are just some important information to know, especially I know you guys are getting the word out for September.
Absolutely.
So thank you so much for joining us. We really appreciate it.
Thank you so much.